Good morning and welcome to the GDDS User Group conference call. All lines are now fully interactive. Please be aware that any background noises, conversations, or placing your line on hold will broadcast into the conference. Please utilize either your phone's existing mute function or via touch-tone phone you can press 61# to mute and 60# to unmute. Please also note this call is being recorded. I would now like to turn the conference over to Leslie Sanovich. Please go ahead.
Thank you, Chad. Good morning, everyone, and Happy New Year. Welcome to today's rescheduled GHA, Georgia Discharge Data System Strategic Planning Monthly User Group. From GHA, we have Bill Wiley, our Senior Vice President of Business Operations, and Sharifa Navos, our Data Integrity Specialist, on the line with us as well. We appreciate you being flexible to move this date to more of the middle of January. The first week of January felt like most people or many people were on holiday, and last week we hosted our Patient Safety Summit, which some of you may have attended, and we felt like that would not be a good week as well, so that's why we rescheduled to this week. Before we get started, I just want to make sure everyone can hear me okay and can see my screen. Somebody could verify.
All set.
Yep, we got
Great,
you, Leslie.
thank you. Awesome. Well, we'll get started. We have not a detailed agenda, but want to go over the 2019 data submission schedule and publication of the data. Bill's going to touch on, again, the submission module that we are going to be rolling out this month. We're also going to just have questions and feedback on the strategic planning module and any updates or feedback that you have for the module now that we've been using it for some time. And again, we'll have a time for questions in our open forum. As we normally do, I like to give an overview of what the Georgia Discharge Data System is. We always have new users on the call, and we also, for this call specifically, invited all of the HIDE Online, the HIDE Net users, and those are the people who are the uploaders of the data. So some of those folks are on the line as well. But as you are aware of, there is a state law, state mandate that Georgia has for submission of the discharge inpatient and outpatient data, and GHA is the vendor for that data. The hospitals, our vendor is HIDE, and hospitals upload their data in the UB04 format into HIDE. It is then processed. There are validation checks that are performed automatically to validate zip codes, to validate diagnosis codes, procedure codes. All of the data is run through many validation checks automatically when it is uploaded. After it is processed and validated, it is then deemed the Georgia Discharge Data System. GHA receives a set of that data. We then pass that along to the Brain and Spinal Trust Fund Commission on your behalf, also to the state of Georgia. It is a cut of that data set is also made available to the Agency for Healthcare Research and Quality and the Healthcare Cost and Utilization Project. Those two agencies use the data for researchers, and so that is how that data is handled. The schedule for the 2019 GDDS is here. We will post that, and we are going to be posting on the GHA Data Services webpage all of our documentation. So for our next call, that call will be centered around showing you how to get to all of the documentation and forms and information about the GDDS on GHA's website. So this is just a schedule. Right now we are receiving November data for 2018, and Sharifa will give us an update on that data submission. That data was due yesterday, and so she is monitoring that data and contacting hospitals who have not submitted or who have issues with their submission. Sharifa, I'm going to let you go ahead and go over what you do on a daily basis when data is submitted and how you review and verify it.
Thank you, Leslie. Good morning, everyone. And so, as Leslie said, many of you are familiar with this website because that's what you use to upload the data. So this is just the home page where you would log in to HeidiNet, and once you log in, you'll have different options, and to upload, you would just click on upload and make sure that your file is in the specific file type, and I circled that at the bottom so that you can see that they accept or zip files of a certain size, and you upload it, and once you upload it, you can go to the status page to make sure that it's processing and uploading. This is the documentation tab where you can find different, forms or references or guides for your data. There's the UB04 record layout, which is what you would send to your vendor to map out your file. There's also different county codes and authorization forms there, and if you want something to be added there because you think it'll be helpful for yourself and others, you can also request that, and we can have Heidi put it there for your reference. Like I was saying, clicking on the Home tab will show you the users or the data uploaders for your facility, their name and last login. And so we recommend that you do that just from time to time to let us know who you would like us to add or remove. We typically like to have 2 people per facility. Just in case we can't reach out to one, we'll have somebody else to reach out to. At the bottom there, the status tab allows you to look at your status for the year prior and the current year by quarter. And so you can look at your volumes at a glance for inpatient and outpatient records. And also at the bottom, you can look at what has loaded, if the records were dropped, if it was deleted. So you can look at all these and see and make sure that your data was loaded properly and that it looks good across the board.
Also, in these columns, the low date and high date, the low date is the, now that we're in a monthly data submission, it's the earliest date in your discharge data that was submitted through the latest. So you can see this is an August of 2017 submission.
In the Reports tab, you will be able to see whatever is generated. So anytime you submit a UB04 file, there is a PDF that is generated, an edit detail, a verification report, and also an edit summary report. And you can also ask for, like if you want a zip comparison report or anything like that. But those are what I look at when I'm making my, when I'm reviewing the data. And we recommend that the data uploader or whoever is in charge of, in your data department, to look at that verification report also after submitting the data to make sure that everything is distributed evenly and correctly. So those reports are really helpful in figuring out where your errors are. You can review the edit detail, especially you can review patient records to make sure that that particular record or chart is corrected. So you can see where your errors are and where your discrepancies lie, if you have any in your data.
And after you upload the data, anyone who is assigned as a user to your facility, after the data is processed, they're automatically emailed an edit summary report that just gives kind of a high level of counts, and if you have any fatal edit warnings, and that kind of is the first thing that you would look at to know if you need to delve deeper into your data and making any corrections.
Yeah, thank you, Leslie. And I'll show you that one. Also, I have a slide for that to show you what it looks like. But here's the verification of data report. And it used to be about 8 pages. Now it's about 14 pages. There's been some pages, some information that's been added there that I think is helpful. But this is the first page where it kind of shows you an overview of your data quarter by quarter, month by month, and also so you can do a comparison with the previous year. So you'll see the discharges for 2007 and 2018, and that allows you to compare, make sure that you're on the right track. And then anything in red is just the discrepancy. It doesn't mean that it's a bad one, it's just that if it's, I guess, more than maybe 10% of the change, or if, I'm not sure what calculation they use for that, but most of the time, you just want to review it and make sure that you're still within the range of, your volume or your distribution. And so that's a good way to highlight the major differences in your data. So this is the first page. You can go to the next page, and then this is the discharges by patient type. So patient type means inpatient, ambulatory surgery, ER, and stuff like that. So when you look at that, you look at the previous year's number, the current year, and as you can see, this facility hadn't, at the time that this was pulled, they hadn't uploaded their November data. So you see that at the bottom. But once they do, a new verification of data report will be generated, and then you'll be able to see everything. So their data looks pretty consistent when you're comparing. And, it's good to, again, glance and look at that once you submit your data. Next slide, please. And here's a distribution by primary payer. So this is insurance information, which is important to keep, track of your Medicare, especially Medicare, Medicaid, and other types of insurance. Make sure that distribution is valid and correct. And at the bottom there, the percentages in red, again, it's just the fluctuations in volume. So you would just look at that to make sure that there's not a huge fluctuation up or down in your volume. So next one. This is for the outpatient, so same thing here. Now this is the admit type, point of origin, and also demographics information like the patient's gender. So again, you're just looking at the comparison from the previous year, and it's a breakdown, and the red numbers show you if there's been any fluctuation. Go to the next one. And again, patient disposition is another page showing where the patient went after being discharged, and so you want to look at those numbers too to see if everything correlates and if everything matches up. Again, another demographic component that they look at, which is the patient's race, to see the distribution in that also. So those were the original 8 pages, and now they've added the frequency of top 250 zip codes for inpatient, and so which is something that you can pull, using our Javion, the analytics platform, but this kind of gives you an overview of the frequency, and this is the top 250, so you'll know, where mainly your patients.
Is that the HIDI, H-I-D-I?
You said, is that from Heidi?
Sorry, I wasn't talking to you. I'll put my phone on mute.
Oh, okay. Sorry. All right. You can go to the next slide, Leslie. And here's another new addition. This is the DRG, so top 100 DRGs, which is helpful for people who actually do this type of, or who pull this type of data from Javion. You can use this as a comparison tool as well. And then it gives you the frequency of all DRGs with at least one case. So you can go through that. And the next one, the next slide also shows you the same thing for, the DRGs for inpatient. You'll have inpatient and outpatient. Can you go to the next one? I think the next one is, attending physician. So For inpatient, so the frequency of top 100 attending physicians. Now it has their NPI number and the physician name, which is blocked out, but you'll be able to see it. Hold that, and then this is for outpatient. So here's what Leslie was referring to, the edit summary report. And so that report is where it shows you your fatal errors versus your warning errors. And the fatal errors counts towards the 3% threshold. And I've emailed some of you about this, and I guess I urge you to, especially for 2018, to go through and make sure that your data is under that 3% threshold, the fatal error rate of your file. And it shows you what the error message is and the count, and so you can pull the edit detail report to look at the specific records that have those errors. And so you'll see a fatal error warning, and then also in the edit detail there'll be an informational, which is not shown up here, but it is on the edit detail report. And this is not used towards the fatal error calculation, but it's just a flagged edit. Go to the next one. And so here, that's where, it'll show you if you're above or below. And in this example, they're below the threshold at 0.22%, so then you would be fine and you don't have to do anything. But some people do like to look into it, just so that they know if there's a trend in these errors, and they can, the earlier you catch your errors, the better your data will be in the future. And this is the edit detail report, which looks like the edit summary, and then when you go to the second page, it gives you a detailed report of the attending physician, so you'll have the NPI number there, and of course it's confidential information, so we can't email that to you, but you can access it through the website because there's some GHA, some personal information there, so you'll have the birth date, which we blacked out, but you'll have the MRN number, patient record number, or medical record number, and then all the errors listed for those with the fatal errors.
Anything else, Teresa?
That's it really that I have, and a lot of you know this already, but I just wanted to, go over this and really, I guess, make the point to make sure that you know that this is available to you, so you can look at your data in in more detail and make sure that it's correct every time you submit it, because that's what I do, and it's good for all of us to work on that. And also, if you haven't submitted your data, if you could do that also. It was due yesterday, November data. I'll be emailing you, regarding this today. Any questions?
And Sharifa, how can if somebody wants to have access to that, how do they go about getting a login for that website?
Oh, you can just email me, and then I'll forward it to Heidi, and then they'll email you with your username and password, like a temporary password that you can change. So you can just email me.
Great. And if you don't currently have a login and you don't need one, but you want to know who in your organization is uploading the data, don't hesitate to contact myself or Sharifa. Will be happy to give you a list of the users for your facility. And you can always ask those users to forward you the edit summary report when they receive it as well, if it's something that you want to review. But the important message is that there should be more, one or more people in your facility reviewing that data submission. All right, we'll move on to just to give you a quick overview of data authorization forms so that you know what they are. We do.
Excuse me, I have a question.
Sure.
On the last segment, if you make corrections, once the corrections are made, or how we tell our people to make corrections, do we resubmit it after corrections are made?
Yes. Yes. You absolutely would.
And we recommend that you make those corrections in your system first.
Right,
and
right.
Then, and then upload a new file, and you delete the old one and then upload a new one.
Okay, so once the corrections are made, I'm sorry, my name is Herman. I'm calling from East Georgia Regional. It's a hospital. And because my director, acting director I'm in the IT department, but I sent this to the admissions director because most of our errors, we was a little bit over the 3%. And most of the errors was on the race and ethnicity. And they were trying to make those corrections. They was having some issues. So who can I reach out for that or have her reach out to about that?
You can reach out to me, and I'll be able to use whatever resources I have to help you with that.
Okay. Because she asked, and I was like, all I do is run it. I didn't know anything else. All I do was run it.
And that's true. There's a lot of, a lot of IT departments who submit the data, but we do want the data reviewed. But, yeah, just send whatever concern she has to me, and I can do some research and work with Heidi to guide, you guys in the right direction, yeah.
And what was your name again? I'm sorry.
I'm Sharifa Navose. My information will be at the end of this.
Okay. All right, then.
And you can email me or call me, yeah.
All right, thank you.
Thanks, Herman. That was a great question, especially for other people on the line. It's a very good point, Sharifa, that I was trying to make earlier, that there are a lot of IT departments that do upload the data, but they're not necessarily the people who need to review the data that have been submitted, the reports. So make sure that you have a good process in place for submitting and reviewing the data. Moving on to the data authorization forms, there are several that I'm going to go over. This is the strategic planning authorization form, the visualization tool that we're now using through Javion. It's simply, you need to email myself or Sharifa to request the form, and we will send it to you, and you complete it, and then the CEO or their designee need to approve that user. We also allow consultants to use the tool as well, as long as the facility has a consultant data use and confidentiality agreement, and GHA requires a copy of that to have that on file as well. And once you send that back, we will get your account set up and you can use the tool. So again, right now these have to be emailed, but beginning next month we'll have these all available on the website, and we'll demonstrate where you can find those next month. The second authorization form I wanted to just bring to your attention is the GDDS custom data request form. This is user requests that can't be completed. I'm sorry, I have Analytic Advantage on here. That cannot be completed using the Javion tool. And we are currently working with a couple of facilities to fulfill a data request outside of what can be accessed through the Javion tool. So that is available to you as well. And we're going to be making live the readmission visualization tool. And I'm going to let Bill talk about how we approach the authorization on this tool that allows users to have access to patient-level data online for their facility.
Thanks, Leslie. Yeah, we do have, and I think we talked about this at an earlier one, and we've had several of the rural hospitals already do this because we wanted to get those guys up and running as soon as we could because of a grant that we got. This module should go live this week or early next. They're moving it over from our test environment over into the real. We've done another data upload, so we know that it's working. But we have, honestly, in this case, we have two forms. And you'll understand it when you kind of get in and see what the ability to download. There will be true patient record in there. So, I mean, if there's a readmission, you will be able to identify which patient was readmitted. So, you know, there's going to be a lot of access. So we have two forms that we want to have. One, we want to have the CEO authorize the fact that people are going to be able to get to that patient level information. So just a way to kind of recognize who wants to have access. We want to just reaffirm that the CEO is comfortable with having access to this module just from, you know, a HIPAA and a privacy and all of those types of reasons. and you can see down at the bottom of that form, there's a place for the name and title of the folks that the CEO wants to have access. So we're not restricting it, but we just want them to recognize the importance of the data that's there and the importance of the privacy aspect of that. So once we get that form, we'll then turn around and submit one to the user itself, again, just to affirm that they know that they will be having access to patient-level information. Again, it's a very belt and suspender type of aspect, but we just thought that was something that folks really need to know about because of what's there. As we've talked about, this is going to be a free program, so we hope every hospital has access to it, and we hope they all agree to do it. But we just want them to be very mindful and deliberate over who gets access to this program just because of the amount of patient-level data that's in there. We're real excited about it. It's going to tell you your percentage of readmissions. This is not a readmission calculation program. This is about what you actually had happen. Okay, and Leslie's got a screenshot. She's already ahead of me. So, in this case, for this hospital, which we've blended several hospitals so we could show this, their readmission rate was right at 12%, and their Medicare only was 16%. So you can see down there when they were readmitted, the time of date, where they were discharged to. So you could see if, you've got a discharge or care coordination issue because you've got a high percentage of folks that were discharged to home that may or may not have had the support level that they need, and also the readmission rates. They're going to be all the different Medicare conditions. There's a drop-down menu under select conditions that has all of the different Medicare conditions that are being looked at. So we can also do it by where the readmissions came from by the county. That's actually the tab under the readmissions strategy. What was it called? That one. So you can see where the readmissions came from. There's one by doctor. There's one by service line. And just like the other tool, you're able to drill right down into it and kind of see where those readmissions came from to just help you understand that. We've got one outstanding question that we want to do, and that's where how much information can we show related to a different site readmission. That's in the calculation, but it may or may not show up in the drill down itself. So we've actually got an outstanding question to our attorney that's helping us with the other aspects of this grant to see how we can show that and be efficient. Because we think you ought to be able to know that it was not just a readmission to your facility, but it was a readmission somewhere else. And so you could figure out, is that a service we just didn't provide, so there's nothing really we can do about it, or if it's some other type of issue that's going on. So that's still the outstanding question, but we didn't want to have the perfect be the enemy of the good, so we're ready to roll this out now. So Leslie, do you want to tell them where they can get access to the forms, or we just want to email them? How do we want to handle that part of it?
Currently, we are going to be emailing them, and we're in the process of migrating all of our content, our forms and documentation to the GHA website. We actually have a meeting tomorrow to work on where on the data services page that'll be housed. So again, the focus of next month's call will be to demonstrate where all of that information is located. So for the time being, yes, if you would just email myself or Sharifa, we'll be glad to send the appropriate forms. Now, Bill did, I believe, send to the critical access and rural hospitals to their CEOs the CEO authorization, some of which we have received back, but I know that we haven't received all of them back. But if you do contact us, we'll be sending that to the CEO first. The CEO will identify the users that they want to have access to the tool in their facility, and then once we receive that list of users, we'll send a user authorization form to that individual. Any questions? Well, I did want to mention as we move on that the data on the Javion Analytic visualization tool has now been updated through data through September. So that is through third quarter. We are, moving in the direction of updating that data more frequently, but right now it's updated through September. Is there any feedback or questions about the visualization tool? We have, made a few updates to it. I'm going to drag the actual live tool over, and as you can see, we've got September data here. But we've gotten some really good feedback from users. We also have gotten feedback from what I call high-end or Uber users that they're not able to get as granular into the data. And I know Bill we've talked about this on the last couple of calls that, we kind of reined in some of the granularity of the tool, and where there is a need that makes sense for the facility, we're able to provide additional data in a more granular format if needed. Bill, do you want to touch on that?
No, just that we've heard what the folks are looking for, and we think some of those requests are right in line with what this tool's designed to do, and we're going to work on getting that level of information so that you can continue to run those reports that you've used month over month and quarter over quarter for you.
Any questions, feedback?
Hey, Leslie, this is Laura. So how are you suggesting you're going to do that? How is it going to be similar to the Analytics Advantage level when you do make that change?
We're not talking about making a change. We're talking about entertaining and evaluating individual requests from hospitals. If there's a data request that you cannot fulfill using this tool and you are not a limited data set subscriber, we can work with you on getting you the data that you need.
Leslie, hi, this is Holly from Children's. I didn't know how the group felt about the age brackets, because obviously this is not all about us, and we also have a limited data set. But in the age bracket drop down, it says 0 to 17, and we think of children as 0 to 18 and sometimes through 21. I had thought at one point Javion was going to do these age brackets, but then have under that age bracket drop down the ability to create like custom age bracket groups. And again, if that's not on the roadmap for the product, it's fine because we're LDS users, but I didn't know how other people looked at peds versus adult.
Thanks, Holly. Please, anybody jump in and give us some feedback on that.
This is Greta Guzman. We look at 0 to 17 as peds.
Hey, this is Laura. I think sometimes it depends on who's asking for an analysis and for what purpose. But, 0 to 17 is typical, but sometimes it can vary depending on what's being requested.
Well, thank you for that feedback. I don't think that we'll ever have a tool that can be all things to all people, but we do welcome your feedback and want to make this as helpful and, to benefit you as much as possible.
Well, maybe we could look at expanding that 18 to 44 and do like an 18 to, 20, 25, 26, that
26.
Someone could still be on their parents' insurance, and do a 26 to 44, because 18 to 44 is a pretty big gap. But the original iteration had a year for everyone that was in, we actually, someone in the state treated a patient that was up to 104 years old, so we had 104 different drop downs, so we had to make those brackets. But maybe we could look at expanding that 18 to 44 to cross that bridge just a little bit better.
Sounds good. If I had my druthers, it would say 0 to 17, 18, 19 to 21, and then 22 on. But again, that's just me, and I will continue to use the LDS. It's all fine.
No, I mean, that may be an easy thing to do, and if you're asking, then others are thinking it. So, you know, that may be something that we could look into. It's really not that hard to add those kind of brackets. We just don't want to make it where it's so many selections that people can't remember what they did the time before.
Right.
Or slow down the tool because there's so many, because it becomes cumbersome to churn the data. But yeah, thank you very much for your feedback. Anything else? Any other comments about the tool and the drop downs and?
Leslie, this is Julie Ballantyne at Northside.
Hi, Julie.
Hi there. And I've been trying to attend these calls, but granted, I haven't had a consistent presence. But I have had some time to play around in the new JVon tool, and we are users of the current HIDE Analytic Advantage. And we're finding that consistently across the board for the type of projects that we're working on, the JVon tool is not really helping us be able to complete those projects. And I was just wondering, you had mentioned that on a project-by-project per-case basis, a hospital can submit a request to you all to get more granular data. I'd like to understand the impact of that, because for us, that's going to be just about for everything that we do. And so that sounds a little inefficient.
Flash breaking new ground.
Oh, somebody's put us on hold.
So I guess I just wanted to understand a little bit more about, you know, like we used to be able to get to the MSDRG level. We can't. We used to be able to export the data so that we could run our hospital bed need per the DCH bed need model. Now we can't. I mean, it's like literally everything we used to do in HIDE Analytic Advantage, we can't do any of that in JVon.
Right, and we are trying to find a balance between the running what we were hearing from many, not all, but many, was that they weren't able to run quick dashboards or quick out-migration or market share reports from Analytic Advantage. And I don't want to make this about one product over the other or one vendor over the other, but in all of our, also all of our meetings and our conversations with other state hospital associations that Bill and I attend, the visualization is the way it seems like many associations and users are moving in that direction. And so that's for, you know, the marketing person, probably the CEO, the CFO, that want to run quick analytics on the data. And on the other end of the spectrum, we have true data users, in your case, Julie, who really dig into the more granular data. And that is one reason we have the limited data set available, so that you can get a de-identified patient-level data set to load into your system and use the data, you know, according to the guidelines, but to use the data internally as you need to. And so that's, I think, what we're struggling with is finding that happy, again, the happy medium, but also the fact that we're trying to please two distinct sets of users.
And if these are routine extractions that you're running on a monthly, quarterly basis, that's kind of what the new process for us to just upload that automatically to you. So that may be something, if that's something that you have used over and over and over again and it's the exact same query, then that's very easy for us just to run right off of the actual database.
And I do appreciate that offer, and I think maybe for the Department of Community Health bed need model, I think that's something that could be a solution for. But I oversee the strategic planning department, and so much of what we do is, an ad hoc analysis basis. There's nothing really, routine every quarter. We're doing the same analysis. So, I know there's not a solution, and perhaps we can continue a dialogue offline. But, unfortunately, we're seeing that the usefulness of JVON for us as an institution and the way we use it is really lacking compared to what we had access to in ID Analytic Advantage, unfortunately.
Julie, we'll continue this offline. I'm going to, after this call, we'll make a note to maybe set up a call with you so we can get some more insight.
That'd be great. I appreciate that.
Any other thoughts or feedback?
Hi, Leslie. This is Deborah. I was a little confused when you started showing the user forms. I already have a JVON sign-on. Do I need to do it again?
No, not for. If you already have a JVON login, you do not need to do it again. I was just wanting to make people.
Basically for just brand new people that might start it.
Yes, or if you have anyone in your organization, Deborah, that you wanted to add, just showing you the process for gaining access to the tool.
Okay, thank you.
You're welcome. Any other questions? Feedback?
Hi, this is Natasha in Encompass Health Noonan. I was wondering where the schedule will be at for the submission schedule will be posted.
We will be posting that on the GHA Data Services website, and I'll make sure to cover that next month on our call when we have all of that, all the new forms, updated forms, and documentation loaded.
Thank you.
You're welcome. Well, if there's no more feedback or conversation that we need to have, we'll give back a few minutes of the day, and let me get to our information so that you can see our contact information. This is our schedule for the 2019 group meetings. As always, we may need to be flexible depending on. Sometimes during the summer we run into a lot of people being out, but we'll try to make sure that everyone's aware. But the user group meetings are the first Wednesday of each month at 10 a.m. They are being recorded. We've had difficulty in the past year with some of the recordings, but we will be either posting those recordings to the GHA Data Services website or to a YouTube link or YouTube channel, in which case the link would be sent out to users if you missed a call, weren't able to attend, that you could go back and listen to the recording. Here is our information. Don't hesitate to call us if you have specific needs or questions or would like a one-on-one webinar for you or for your team. We'd be happy to do that. We're here to manage the data program and make the data submission process as seamless as possible, and then also make the data available for the users to utilize in their facility. If there are no other questions or feedback, I hope you have a wonderful rest of your day. We're already into the second half of January, and we will look forward to having our next call on February the 6th. Have a great day.
Leslie, I have a question. This is Greta.
Yes.
Hello?
Hi, Greta.
Do we have release dates for the quarters, so quarter 4 of 2018?
Yes. Hang on, let me get all the way back up to the top. That's one of the first slides.
Sorry, I missed that.
That's okay. And we're going to be posting this as well. There it is. So for the fourth quarter, the data, or the November data was due yesterday, and so Sharif is still rounding some of that data up. The December data will be due in February, and the data will be loaded into the tool by, around the last week of March, March 24th.
Perfect. Thank you.
You're welcome. Anything else?
I have a question. Who is the contact if we wanted a custom data pool? Is there a formal process for that?
Yes, there's a form, but probably having a phone call prior to that would be helpful, and you can certainly call me. This is Leslie.
Okay, thank you.
Will you share the slides?
Absolutely. I'll send the slide deck out to the attendees of this call.
Thanks.
Well, if there's no more feedback, this will conclude today's talk call, and we'll look forward to speaking with you next month. Have a great day.
Thank you.